Hello everyone, I'm Anas Al Abuidi, and the title for this lecture or session or the topic is Patient Monitoring and Long-Term Treatment Documentation, which is part of Chapter 32, which is Review of Hematology and Oncology Scribing within the Certified Medical Administrative Assistant Course Program by ACMSO. Introduction. Patient monitoring and long-term treatment documentation are critical components of effective healthcare delivery, especially for managing chronic and complex conditions. These processes ensure that clinicians maintain a detailed account of a patient's health status over time, enabling timely interventions, treatment adjustments, and optimized outcomes. For medical scribes, mastering these skills means more than just recording symptoms. It involves creating a seamless narrative that connects history, diagnostics, treatment plans, and outcomes. This level of precision is essential not only for enhancing the quality of care, but also for ensuring that the healthcare team operates cohesively. Effective patient monitoring involves tracking key health parameters, analyzing trends, and documenting all details accurately to support clinical decision-making. Chronic conditions such as diabetes, hypertension, rheumatoid arthritis, RA for short, and cancer require continuous observation and adjustments. For instance, a change in lab results or a recurring symptom may signal the need for medication modification or referral to a specialist. Additionally, long-term treatment documentation addresses various stages of care, from medication adherence to evaluating the effectiveness of lifestyle changes like diet and exercise. Key points. Foundations of patient monitoring will start with tracking long-term symptoms, documenting disease progression. For chronic disease like RA rheumatoid arthritis, symptoms such as joint swelling and stiffness evolve over time. Monitoring their severity, frequency, and associated factors, for example, weather activity level, is key to understanding disease progression. For example, for a patient with RA rheumatoid arthritis, document weekly changes in swelling, morning stiffness duration, and responses to interventions such as NSAIDs, non-steroidal anti-inflammatory drugs. Chronic versus acute onset. It's crucial to distinguish between long-term symptoms, for example, chronic pain, and acute flare-ups that require immediate interventions. Accurate timestamps and descriptions help clinicians adjust patient management plans effectively. Impact on quality of life. As beyond symptoms, monitoring how a condition affects patients' daily activities, work, and emotional well-being should be part of the documentation. Tracking subjective factors like mood changes or physical limitations illustrates the holistic impact of the disease. And here's a diagram and cycle of long-term symptom monitoring. Regular diagnostic monitoring, key lab laboratory or key lab, and imaging trends. Chronic disease management relies on repeating specific tests to detect changes. Examples include HbA1c levels for diabetes, lipid panels for cardiovascular risk, and creatinine levels for kidney or renal function. Example include trends from monthly HbA1c reports in the documentation, especially if the patient's diabetes is poorly controlled. Imaging such as X-rays or MRIs also serves to document progression. For instance, rheumatoid arthritis RA patients benefit from annual imaging to assess joint erosion. Recording normal results, even when results don't change or indicate improvement. Documenting normal findings matters. It confirms treatment effectiveness and serves as a benchmark for future comparisons. Medication impact assessments. Many drugs for chronic illnesses require regular labs to prevent side effects. For instance, DMARDs, drug modifications, disease modification or disease-modifying anti-aromatic drugs require liver enzyme checks, while diuretics necessitate potassium monitoring. And here is a diagram cycle of chronic disease management. Treatment plan documentation, adjusting medications. Scheduling medication reviews. Regularly noting medication schedules, dosages, and changes is vital, particularly for conditions treated with complex regimens like hypertension or autoimmune diseases. Example, patients' blood pressure medications adjusted, switched from lisinopril to amlodipine due to cough side effects. Side effect management. Documenting any adverse reactions, ensuring continuity of care, particularly when initiating or tapering treatments. Record severity, duration, and interventions taken. Patient compliance tracking. Long-term treatment success hinges on compliance. Record patient-reported adherence issues, for example, forgetting doses, cost barriers, and clinician recommendations. And here is a diagram on comprehensive medication management. Behavioral interventions, lifestyle modifications. Chronic illness care often emphasizes lifestyle interventions such as dietary changes, exercise, or stress management. Documenting compliance and results is crucial. For example, patient reports consistent adherence to the DASH diet. Blood pressure improved from 140/90 to 125/8 over 6 weeks. Patient education. Record educational discussions regarding disease management or medication safety, for example, explaining insulin dose, timing for diabetes, or food care for neuropathy patients. Psychosocial factors. Long-term illnesses can cause stress, depression, or anxiety, including mental health. Notes ensures a thorough understanding of how the condition impacts the patient. Continuity of care and follow-up. Longitudinal monitoring, standardized assessments tools like the DAS-28 for RA rheumatoid arthritis or PHQ-9 for depression provide numerical scores that facilitate long-term comparisons. Documenting these scores standardizes follow-ups. Goal-based tracking include progress toward clinician set goals such as BMI, body mass index reduction, improved joint ROM, or lower glucose readings. Interdisciplinary collaboration, coordinating specialists, complex conditions often require input from multiple specialists. For example, cardiology and neurology. Document referrals, consultation notes, and follow-up actions in a concise yet detailed manner. Example, document rheumatologist input on optimizing RA rheumatoid arthritis treatment alongside endocrinologist recommendations for osteoporosis prevention. Summarizing key insights, aggregating inputs from labs, clinical observations, imaging, and specialists' opinions ensures a unified patient care plan. Summary tables. Here we have a table on key symptoms to monitor in chronic conditions, table on common diagnostic tests and long-term monitoring, table on common treatment adjustments and the monitoring, table on follow-up care and patient-centered metrics, table on workflow best practices and long-term documentation. And next, we will revise what we have covered via this lecture through some MCQs and multiple choice questions. Question 1. What documentation practice ensures effective longitudinal monitoring of a patient's chronic condition? A. Recording only lab results from initial diagnosis. B. Tracking symptoms qualitatively and quantitatively over time. C. Summarizing patient history without highlighting changes. Or D. Omitting test trends and focusing exclusively on symptoms. Answer is B, as longitudinal monitoring requires analyzing both the subjective qualitative and measurable quantitative aspects of a patient's condition to identify trends and assess progression. Question 2. A patient with RA rheumatoid arthritis shows increased ESR and new joint swelling. What should be the focus of documentation during the visit? A. Prior medication adherence and response to therapy. B. Psychosocial stressors unrelated to RA rheumatoid arthritis. C. Inclusion of only baseline lab values. Or D. Comparison of symptoms from other autoimmune diseases. The answer is A, as when assessing disease flares, documenting medication use and its effectiveness is key to deciding on treatment adjustments. Including baseline labs and trends adds context, but prioritizing previously prescribed therapies helps refine care decisions. Question 3. Which diagnostic test is most appropriate for routine monitoring of a diabetes patient's treatment plan? A. Lipid profile. B. Hemoglobin A1C, HbA1c. C. Bone density scan. Or D. Complete blood count. Definitely the answer is B, as hemoglobin HbA1c reflects average blood glucose levels over the past 2 to 3 months, making it fundamental for tracking diabetes management. Question 4. Why is tracking patient compliance crucial in long-term treatment documentation? A. To ensure referrals to specialists are limited. B. To prevent documentation overload during patient visits. C. To identify barriers to treatment and adapt care strategies. Or D. To reduce the frequency of follow-up visits. Definitely the answer is C, as highlighting compliance issues such as difficulty affording medications or missed doses helps clinicians address barriers and modify care plans. This enhances treatment efficacy and patient outcomes. Question 5. What is the benefit of including standardized assessment scores, for example, DAS-28 in chronic condition documentation? A. They replace the need for narrative descriptions of symptoms. B. They provide consistent measurable data for tracking disease progression. C. They eliminate the need for repeating diagnostic tests. Or D. They focus documentation solely on physical symptoms. Definitely the answer is B, as standardized scores offer objective measures to track a patient's response to treatment and disease activity over time. They complement narrative descriptions and diagnostic tests rather than replacing them. Broader assessments often extend beyond physical symptoms to evaluate overall function and well-being. And here we come to the end of this lecture. Thank you very much, and goodbye.